So this grand rounds has to do with the topic of a patient's environment and how their environment actually impacts their healing experience. And we're talking about both the inpatient and the outpatient setting. And you might wonder, well, what in the world does this have to do with medical ethics? Actually, it has quite a lot to do with medical ethics. So that's why we've put this in our grand round sessions for today. So stay tuned. The objective is, firstly to let you know what environmental care is, certainly why it's an ethical issue, and then what you can do in your own work, whether it's inpatient or outpatient, to optimize environmental care to enhance patient satisfaction and promote patient wellness. So the first thing you want to do in analyzing the concept of environmental care is to look to your senses. So if you look at your environment, how can you tease it out? How can you deconstruct what's in a patient's environment? Well, you can look at it by sight, sound, smell, touch, and taste. And these are very concrete things. You can assess them with surveys. You can assess them with interviews. So it's not something that's nebulous. You can actually get real data back. So I ask you to look at these in your inpatient settings or the outpatient settings and get some data back and see what you can do. This is the first one we'll start with, and it's sight. So what in fact are your patients looking at? What do they see when they're in the clinical setting? Whether that's the waiting room, or that's the bed and they're looking up at the ceiling, or it's the hallways that they walk in your clinic or your hospitals, or even if they're outside taking a little bit of a walk. What in fact are they looking at? What are they being exposed to in terms of the things that they see? This is how you'll assess the first part of environmental care. So in doing so, I think I'll show you this picture. And this is real. This is not far from where I live. And just ask you to ponder this photo for a moment and ask you what are your reactions to this. I can tell you from my perspective, I've got two reactions. First being, number one, I would never name my medical practice with the word cancer in it. I find that a very negative term, and I'd find another way to present what I do in my business rather than use the word cancer. The other thing I would do is I would have my building cleaned. This particular building is absolutely filthy, and if I was a patient or a family member proposing to bring someone in my family to this clinic, the first thing I would notice is how absolutely filthy it is on the outside. And either the doctor or the practice manager doesn't have much pride in their business, or they would take a look at this and take care of it. It wouldn't take much to fix this up, and also to put a proper name for the business. So that's your first stop. And then how about this? If we've got these two photos here, they're similar. They're both of nature and they're both of water. But if you take a look at these, which one do you think would be better for your patients? And this just isn't some subjective, nebulous concept. These things have actually been studied, and I've got some references for you there. And indeed, the one that would be better for patients is the image on the on the right. The one on the left is the crashing waves, and that just presents a bit too much rough, forceful, I don't want to say maybe negative stimuli, but just a bit too much rough stimuli for someone who might not be feeling well or someone who is anxious. The crashing, rolling, attacking waves are just not something that is conducive to peace and calm like you see in the image on the right, which is serene, still water and blue sky. So to think about what you've got in your hallways, your waiting rooms, in your patient rooms. What type of images do you have there? again, studies have shown that there are images that are actually good and healthful for our patients, and these are some examples here. You can see with the landscapes things like trees with a broad canopy, and when you think about it, the broad canopy signifies shelter and comfort, shade, sanctuary, security. The flowers fresh and healthy, and again, not just in a photograph, but look around your building. If you take a walk around your building outside, how are your plants looking? Do you have dead plants that the gardener still hasn't come by and taken care of? Or even in your building, do you have fresh plants that need some taking care of? If the greenery in and out of your building is unhealthy, patients and families don't want to look at that. That's not uplifting. So take a second look at what's going on in terms of landscaping and what your patients are seeing. Something else that has been evolving for the last several years in terms of clinics and hospitals is their architecture. And more buildings are being designed actually to not in fact look like clinics or hospitals. If you take a look at this image here from a children's medical center in Texas, it absolutely does not look anything clinical or medical. And you have very soft tones, very comforting and warm. It just doesn't look hospitalish at all. And that's the feel that they want to create. So keep that in mind. Here's another one, and it's from the same hospital, but it's a different image. And this is what their CEO says. Since ancient times, art has been used as a part of the process of healing by providing a nurturing setting, whether it's a piece of artwork, a courtyard, or other symbols. We're able to use these surroundings to join young patients' spirits, minds, and health. I think that's a very, very forward-thinking hospital CEO, someone who really thinks beyond the nickels and dimes, thinks beyond the numbers coming in and coming out, and really is thinking about whole person care. So this is the way forward. Just as another point here, what you're seeing in this image is this hospital has about an acre's worth of interior landscaping, which also includes a reflecting pool, so that patients walking or using their wheelchairs can have extra stimuli that's actually comforting and soothing. Here's another example of a hospital that does not in fact look like a hospital, and this is the Cleveland Clinic. And looking at the bed there in the lower picture, certainly it is a hospital bed, but it's designed to be more like a regular bed that you'd have in your home. And you might think by looking at that hospital room, oh, well, it's probably for someone who's not, in very serious condition. They're probably coming in for something very minor. There's not even any medical equipment in the room, yada, yada. Well, actually, that's not really true. All the medical equipment is there. It's just hidden. And it's actually behind those brown panels that you see there behind the bed, and there's more panels adjacent on the other side of the bed. So everything is there for the clinical team, and they use it when they need it. It's readily accessible, but it's just not always kept in view of the patient so that they don't have to stare at it all the time and be reminded of their illness. And also you can see in the top photo there the imagery of the warm colors, the soothing colors of the tan and the green, and just colors that stimulate thoughts of life and health. So I think they're doing a great job with that. This is another picture from the Cleveland Clinic, how they use light and plants to give an image of health and well-being at their hospital facility. You can't see it very well, but on the right-hand side, on the lower right, there's also a very large water feature as well for patients and families to enjoy. Here's another example. I recently was in Switzerland, and I got to visit this medical center, and they definitely go out of their way to have their rooms look not like a hospital. Again, it's definitely a hospital bed, but a bed that is also designed to look sort of like a bed you might have at home. Also, like with the Cleveland Clinic, they've got medical equipment, but much of it is stored and hidden behind paneling so that the patient doesn't have to see it all the time. And you see the nice warm colors used, and the photography there on the wall is something that is soothing. This is an example of something that clinic there in Switzerland also does for patients. Every couple of years they have a special art show, and they bring in art for the patients and families to enjoy. And this is an example of some art that was currently on display when I was there a few weeks ago. So as you're checking in the foyer area, you see these beautiful sheep. Now you might say to yourself, yeah, well, this is all great and beautiful and fantastic, and that's for these fancy private facilities who have a lot of money, so they can do whatever they want because the sky's the limit. Well, let me just show you this. This is a public facility, this image that you're looking at right now. This is actually an outpatient clinic that I work in as a clinical ethicist, and it's funded by the government. And it's beautiful. It's just as calming and soothing. You can see that we have gone to great lengths to make it very much a healing space in terms of the artwork, the lighting, the live plants. We've also taken great care to be sure that we don't have a television in our clinic room. We don't want patients waiting, listening to things like car crashes, bad weather reports, domestic violence, all sorts of negative concepts on the television. We're also very careful about what sort of magazines we put in the waiting rooms so that the content there also isn't filled with negative stimuli. So it doesn't take much, and you don't have to be in a private sector system to offer environments that are wholesome and healthy. So I encourage you to think about it. Here's another concept here. Whether you're talking about a waiting room or a patient's inpatient room, TV channels that offer things other than the news or standard television channels, but more a channel of serenity and healing. So a channel that is either just noise, whether that's nature, sounds of nature, or perhaps classical music, or images that go with that, such as nature images. And there are several companies that produce channels that produce, that have these images that are designed just for the healthcare setting. And I've got one linked there for you, as well as a demo if you wanted to watch that. Now, sound is another one of the senses that we need to look at in terms of the patient environment. So we've got to ask ourselves to assess this. What are our patients hearing? What sort of sounds do we have in the clinical setting? And this just posted on the Mayo Clinic's website a few days ago, so I grabbed it. I thought it was great. Unnecessary noise is the cruelest absence of care. And this is actually a famous quote from a famous person. And I'll give you a minute to think about who it might be from. It's from Florence Nightingale. So even way back then, she was thinking about the concept of quiet and the concept of noise and how these things impact the wellness of our patients. So in a nutshell, the way we need to think about this is the fact that noise all adds up, and there's many different types and sources of noises in the clinical setting. Some of it you're not going to get rid of. It's impossible, and you actually wouldn't want to get rid of some of the noises that are there. But other noises, yeah, you might want to get rid of them, or at least tone them down, or have them present at certain times and absent at others. So just looking through this list here, you can ask yourself, geez, well, what can I do? What would, do these need to be present, or can I minimize them? Can we move things to other places so they're not impacting the patient? Can things be done in other areas at other times? That's how you would be assessing the noise that's in your area at your inpatient or outpatient setting. And certainly there's been many empirical studies on noise and how it affects patients. This study here from 2014 in a palliative care unit showed that 77% reported that the hospital environment was contributing to their insomnia. So that's in a palliative care unit. And then in general hospital wards, another study from 2014 found that the noise, on average over a 24-hour period was more than twice that of the WHO guideline. And that was also causing problems with sleep. So it's not a benign thing. It actually does affect our patients. And certainly our littlest patients, our tiniest folks, they really are susceptible to noise problems. And device manufacturers, the people building incubators, do everything they can to make an incubator as safe as they can. But a lot of things go on in an incubator, including ventilation and conversations with staff and families and everything else. And we've got to be careful with the noises that are created in the neonatal and pediatric setting. This is an example here. There's actually an organization in America, a charity, that makes quilts for incubators because they are very concerned about the noise problems in PEDS ICUs or neonatal ICUs. And there's this study here that says preterm infants exposed to prolonged excessive noise are at increased risk for hearing loss, abnormal brain and sensory development, as well as speech and language problems. And then, of course, it gives some ideas here of how to combat that. Now, these next two slides are also from the Mayo Clinic. They were in conjunction with that first slide, the quote from Florence Nightingale. And essentially, they give 10 bullet points of things to consider in terms of looking at noise and noise in your facility and how noise may be impacting your patients. And this first one here, listed as item 10, I think is really important. Noise is not a decibel level. It's an annoyance and a distraction. So if you take the approach that you're going to focus purely on how loud something is, that's really not the tack we want you to take, because that's a very narrow-minded view of what noise is. You need to expand your mind about what comprises noise and sound. And once you do that and you take in all these other things, these other 9 items, you'll have a much fuller picture about the sound environment and certainly the environment of care that your patient is in. Really important here, item 6, noise contributes to confusion and disorientation, which increases the risk for falls. Same thing here, very, very much related. Item 4, a sudden noise can cause the startle reflex, risking a possible fall or loss of balance for medicated or otherwise compromised patients. I like what this hospital, Frederick Memorial, came up with. When it's time for quiet time at their hospital, they have a series of tones that they play over the PA system, sort of like you would hear if you were going to go to an orchestra, and just a few minutes before the orchestra gets ready to go, they have someone come out and they play a few tones on the xylophone to get everybody assembled and quiet. Same sort of thing. I think that's a great idea that hospitals could perhaps incorporate around the world. Certainly also very simple would be posters placed around the hospital. And again, I think you want to think about this in terms of a global solution for your setting. And what I mean by that is the issue of noise and sound and quiet shouldn't be limited to things like the maternity ward, and the neonatal ICU, and let's say the palliative care ward. But really, you need to adopt this as a culture for your entire hospital, that the hospital is a quiet zone for everybody, no matter if the patient is in orthopedics, endocrinology, cardiology, or maternity. Everybody should get the same level of quiet. And you can hopefully institute that through something like this HUSH program. And you can see that there in the bottom. That's a standardized program that many hospitals are using. You can order materials for that, or other sort of little tools that you could implement. But the goal here is to develop a culture throughout your hospital so that all the patients can benefit, not just a particular ward or service line. Next, we go to smell. So what's everybody in your hospital, including your staff and your family, smelling? What sort of odors do you have? And do they need to be there? Can you get rid of them? One of the big things you need to consider is, for example, when you're doing facilities and maintenance work, what sort of paint are you using in your hospital? It's amazing to find out that some hospitals actually are not using non-VOC paint. They're using paint that is actually full of VOC and very toxic fumes. This is really surprising to me because there is non-VOC paint on the market. It's available pretty much around the world, and I've in fact used it. I've painted the whole inside of my home with non-VOC paint. It doesn't cost anything more than the toxic VOC paint, and you can actually still do the painting process in the presence of humans, and they won't even detect it. There's absolutely no odor, so it's safe for everybody. So I encourage hospitals and clinics to use non-VOC paint. I've got a link for you there. According to the American Lung Association, they're actually branding perfume as the new secondhand smoke. I think that's a fascinating concept, but it does bring up the idea of, is your hospital taking any steps to address the issue, the potential problems of perfume and cologne? And some hospitals have. I've got a list for you there. Some have decided to go totally fragrance-free. Others are going fragrance-controlled. But indeed, fragrances can cause problems for some patients, and as well as staff members, in terms of migraines or even as severe as seizures. So you do want to reflect on that and see if that's something that you want to implement in your facility. Touch, another sense we can look at in terms of the patient environment. What do our patients touch? And what about the products that we bring into our hospital or clinic environment? Are they safe for our patients? Interestingly, you can find unhealthy chemicals in a lot of the products that we use for patient care, including feeding tubes, catheters, gloves, certainly cleaning fluids, furniture, carpet. The situation with the furniture and carpet is that they're often made with things like formaldehyde, and the formaldehyde off gases as the products age. So it's a matter of purchasing furniture and carpet that is made in a friendly way that doesn't contain those chemicals so that they don't off gas into the patient environment. Cleaning fluids, again, it's a matter of finding cleaning fluids that are appropriate, that have the cleaning and sanitizing action that you want without being harmful in terms of residuals and fumes for the people who breathe them. And the other products there, those medical products, sometimes contain unhealthy plasticizers. So there is this initiative called Healthier Hospitals. I've got a link there for you there, and they give guidance to hospitals on finding healthy products to put into their systems. So I encourage you to take a look at that. And then the last one, probably the funnest, I guess, to look at is taste. This is where we ask ourselves, what's everybody eating? Everybody, including the staff of your hospital and your visitors and your families. And have we, in fact, optimized that eating experience? Believe it or not, there's actually an article called The Ethics of Hospital Cafeteria Food. And this is pretty interesting, and it comes from the American Medical Association, so you know it's a source of integrity, so that's good. But here's what they say. Just as doctors are responsible for teaching individual patients about good eating practices, so are the hospital systems for which they work responsible for promoting dietary change in broader communities. To do otherwise would undermine their doctors' efforts. I think this is a great quote to think about, and to think about in terms of the mission of a hospital when it provides food for its patients, and certainly its staff that have to take care of those patients. And you might think, oh, well, that's pretty easy, you know, you just fix a good meal and you put it on the plate. Well, actually, no. And this is a fascinating study from 2014. They surveyed cafeteria managers in hospitals in New York, and they found that less than 1/3 even had any sort of training in nutrition. So it's interesting that the people, many of the people working in hospitals running the food service, don't know much at all about nutrition. So the first gate was to make sure that the people working in this area actually are fully trained in nutrition, so that they can buy into the philosophy of healthy eating. This program here I thought was fascinating, the Better Bites program, really novel. Um, in a hospital, what they did was they increased the price of the unhealthy food and they decreased the price of the healthy food to encourage people to buy the good stuff. I've got the article there for you, as well as the contact information for the person in charge of that project, because I feel it was quite novel, and bravo for them. Good idea. And lastly, I'll just remind you too, it doesn't stop there. We got to think about what's going on with our vending machines. So I'd say if you've got a vending machine at your clinic or your hospital, go out and take a look at what's in it. If it contains junk, have a rethink and try to get some good stuff in there. And I do realize that there are things that are branded as healthy that in fact aren't healthy. They can be just as unhealthy as chips and candy bars and soda. So this is where having a background in nutrition and knowing things about what's good and not so good is really critical, so that you don't just make a lateral move from bad to bad. You want to make an upward move from bad to really good and healthy. This is an example here on the left of a company that puts out vending machines at no charge, no installation fee, no rental fee, and you get to decide what you want to put in there. And a lot of people are putting things in like salads and fruits and granola bars and organic juices and things like that. So just food for thought, literally. Lastly here, I've got some resources for you, especially the Mayo Clinic. We've spoken a few times about them today. They are certainly dialed into the environmental care issues, and the commentary there about the WHO and sound. And if anybody's interested more about architectural design in hospitals, I've got a more detailed paper there about the Cleveland Clinic. All right, thanks for listening.